Today's presentation will be on medication safety, and I've titled it 10 Tips from a Pharmacist. Medication safety begins with you. Now, before we get started, I'll just introduce myself briefly because you don't see my face. So my name is Janet. I'm a board-certified geriatric pharmacist and a certified diabetes educator in the Toronto area. I work and I'm part of the Care First Gain team, and I see older adults in clinic and in their home with a team of other interprofessionals. And I have presented on a variety of health-related topics, including falls prevention, heart health, medication safety, and diabetes. So let's get into our 10 tips. So our first tip is to have an up-to-date list of your medications. And you may be wondering why this is important. So this is important because you and your family can know all the medications that you are taking, especially if you're in a situation where you're very nervous, you're not thinking straight, and it's hard to think of everything on top of your head. You may also forget things. So having a list means that make sure that you and your family knows all the medications that you are taking. It also helps your doctor, nurses, and pharmacists make sure that the medicines prescribed for you can be taken safely together. This list also helps to make sure that in the event that you do have to stay in the hospital, that all the important medications you take at home will be continued while in the hospital. Finally, your medication list will help your doctor determine if any illness or symptoms that you experience are related to the medications. So sometimes when you start something new, you might think it's a new illness, but it may actually just be a side effect of the medication. So when everyone knows what you're taking, we can reduce the risk of running into problems and become better at problem solving. So now that we know that this medication list is important, how do we get one? Well, you really have, 4 options. You can get a pharmacy receipt. Some of them have that. You can make one yourself. You can go to the pharmacy and get a meds check, or you can also use a smartphone app, and I'll go into each one in a bit more detail. So the first one that you can kind of use is a pharmacy receipt. This is usually the easiest way. Most receipts will have a printout of the medications. However, the information may vary depending on which pharmacy you get your medications from. So the pros is that, it's very convenient. I mean, we all have to get our medications refilled, and you might have multiple copies. So you can keep one, you can give one to a family member. Some things to consider is that it may be missing key information. So some receipts may not have the directions. It may not have, when you last filled it. And it also doesn't take into account anything that you buy over the counter. So if you take multivitamins or if you take a baby aspirin. So it doesn't take into account the herbals and supplements and over the counter, or even medications that you don't fill as often. So those may fall off the list. So this is a medication list, but it may not be the most up-to-date comprehensive list. Another option for an up-to-date medication list is to get a meds check done at your pharmacy. So a meds check is a free 20 to 30-minute private consultation with your pharmacist to include to review all the medications that you take, including non-prescription, so over-the-counter, prescription medications, natural products, puffers, creams, eye drops, inhalers, so everything that you use. And in addition to it being a record, the pharmacist also checks to make sure everything is appropriate and can help to identify any drug therapy problems that could potentially arise. So not everyone can get a meds check. The meds check is for people who live in Ontario, who have a health card, and who are taking at least 3 prescription medications for at least one chronic condition. There are also meds check available for diabetes. So if you have diabetes, there's a meds check for diabetes. There's also a meds check for people in long-term care homes. And there's also a meds check at home for people who live at home and are unable to go out. So this is a copy of what a meds check may look like. So the next option is that you can do it yourself. So The great thing about this is that you can write it out if you want, you can type it up on a computer, you can make it as big as you want, as small as you want, you can include whatever information you like. So something to consider is that if your writing isn't very legible, it may be better for you to type it up. It is time consuming, or it may be, and you are responsible for the accuracy of the information. So here in this photo, you can see that there is a copy of someone writing out their medication list. So if you look at this website, it gives you a link to download a PDF version of this medication list template and also a Word document. And I'll go over this form in more detail in the next slide. So all the fields in light blue can be checked off or typed in, and you can see that it's very detailed. So you can put in all your doctors, your dentist, you can fill in when you got your vaccines, and you can probably also write in if you had any reactions to anything that you're allergic to. So this is the first page, and it's quite detailed. The second page is where you would put in all your medications. So you would put in the brand name and or generic name, the dose, how you take it, how often you take it, why you take it, when you started, who prescribed it. And you would put everything, including over-the-counter medications, herbals, vitamins, any supplements, and anything that you take on occasion. So if you only take Tylenol, once a month, you can also write that in. And then if a medication is changed, you can just cross it off and then just start a new line or just add a new page to your medication record. A fourth option that you can consider for your medication list is to download an app. So most of us now have a smartphone, and a lot of us are trying to become paperless or to use less paper. So My MedRec is a free app that has been developed by ISMP Canada, and it has many different functions. So you can take a picture of your medication, you can set up a schedule. So if you see in the screenshot here, there's an administration record. So you can actually set an alarm to remind you to take your medication. So things to consider is for some people who are not very tech savvy, it might seem daunting to have to learn how to use a new app. And also you are responsible for entering the correct information for this app. So to summarize, you can, you can get a pharmacy receipt, you can do it yourself, you can get a meds check done or a smartphone app. So that is tip number one. Tip number two is to always ask these 5 questions. What 5 questions, you ask? So these 5 questions, the ones that you see on the right in my slide, were developed to help you and your caregivers have a conversation about medications. And the goal here is to improve communication with your healthcare provider. And it is very important to ask these questions whenever you see your doctor, specialist, nurse, and or pharmacist. And these 5 questions are also available in different languages, including Chinese, Tamil, French, etc. So I'll go over the 5 questions in a bit more detail. So the first question is changes. Have any medications been added, stopped, or changed, and why? The second question is continue. What medications do I need to keep taking and why? 3 is proper use. How do I take my medications and for how long? Number 4 is monitor. How will I know if my medication is working and what side effects do I watch out for? And the 5th question to ask is follow up. Do I need any tests and when do I book my visit? And if you can see here on the right side, it also has a little blurb to keep your medication record up to date. So again, it's very important that you have an up-to-date list of your medications. So these questions are important to ask, especially during transitions of care. So say you were in the hospital and you were discharged and you're going back to see the doctor, or if you're going to get your medications filled at the pharmacy. So during transitions of care, these questions are very, very important. The third tip that I have for you today is that medication adherence is key. So when we do studies about medication and people taking their medications, studies show that around 50% of patients on long-term therapy for chronic conditions, so chronic conditions would be things like high blood pressure, cholesterol, diabetes, about half of these people are not adherent after 1 year. So that means that they don't really take it as the doctor prescribes it. Now, the thing is, with many common chronic diseases, there are no symptoms. So you can't really feel that your blood pressure is high, or you can't really feel that, you have high cholesterol, or you don't really feel that your blood sugar is a bit higher than normal. And the complications of these don't happen until many years of poor control. And so a lot of people, they don't feel any better when taking these medications. They actually might feel worse because they're experiencing some side effects. And so they stop. So if these chronic conditions are not controlled over a long period of time, that's when they can cause complications. So for example, if we have high blood pressure, it's not controlled over time, it may cause a heart attack or a stroke or other things. So it is important to take your medications as prescribed, even if you have no symptoms of your disease, and you don't feel any, and you're experiencing side effects. We'll kind of talk about that in a bit. So with chronic diseases, because you don't feel it, people don't want to take it as much. And this is different from, if you have like a sore throat, or if you have a gout attack, you can feel it. And when you take the medications, you feel better. So people are more willing to take their medications. So you can use a chat box and you can let me know what poor control of high blood pressure, what are some complications? So if you have high blood pressure and you don't control it, what are you at risk for? And Kenneth can help me read it out because I can't see my chat box, unfortunately.
You can also just say, everyone, if you want to just say it out loud, that's okay as well. So someone, Anita, said stroke.
Okay. That's right. Are there any other complications we have to worry about? We'll just, spend 30 seconds on this max. Everybody shy today?
Heart attack. So Sonia said heart attack.
Yeah. Are those the only things we have to worry about when if we have high blood pressure?
If you don't adhere to the medication, then the doctor may increase your medication unnecessarily and cause even more, ill effects.
Okay, fair enough. Yeah.
Someone also said blindness with a question mark. Richard said dizziness.
Okay. So let's go through it. So stroke, that's a big one. Heart attack, heart failure, right? So when your heart muscle has to work hard to pump that blood, that muscle ends up getting big, and that increases the chances of having heart failure when you have poor control of your high blood pressure. Okay, it may also increase your risk of dementia. So dementia is just a symptom like shortness of breath. There's different types of dementia. So it may increase the risk of vascular dementia. Kidney disease, eye disease. Okay, so these are just a few of the complications that can happen if we don't control our blood pressure. And if you have issues with your medication, such as side effects, or you can't afford it, you should bring this up to your healthcare provider and they can help you resolve it. Think of another medication. And if you're not sure about the benefits, then the benefits versus risks. Again, speak with your physician or prescriber so that you can make a more informed decision. So even though when we take medications, we may not be able to get to zero, taking medications to control your blood pressure can decrease the chance of developing complications. So for example, taking medications may decrease the risk of stroke by 40% and decrease the risk of heart attack by 20 to 25%. So that's the third tip. The fourth tip I have is to use one pharmacy for all your needs. And again, why is this important? So a lot of times I know for convenience, we might see a specialist and beside the specialist, there is a pharmacy. And so when you get the script, you go to that pharmacy to get it filled because it's convenient. But we recommend going to one pharmacy because having one pharmacy means a more complete list of your medications. But then people say, you know, if the doctor prescribes it, it must be safe, right? But not everyone is perfect, and the whole system, sometimes mistakes can happen, right? So pharmacies have computer programs that can check for drug interactions. But if it's not your regular pharmacy and they don't have your list, they won't be able to check for interactions, right? Sometimes the physician, if it's a specialist, they may not have the most up-to-date list, and they may not have software to kind of check. The other thing is that pharmacies are not connected, even if it's a chain pharmacy. So if you go to a Shoppers Drug Mart in one area or neighborhood, and you go to another Shoppers Drug Mart somewhere else, because of confidentiality, we don't share the same record. So your file is not connected through all the Shoppers Drug Mart. Same with Costco. So again, these are just some reasons why we strongly recommend just going to one pharmacy. However, if you must go to another pharmacy, you should show them that up-to-date medication list that you prepared so that they can check to see if that new medication you were prescribed interacts with any of your other medications. So tip number 5 is to take your blood pressure properly. So what I'm going to do now is I'm going to show you a couple of photos, and if you want to participate, you can, you can let me know what is wrong with the technique, or you can just type it out in the chat box. So here is the first picture, and just let me know what you think is wrong with this gentleman's method.
You should not take the medication with coffee or tea.
Okay, yeah, so taking coffee.
Teresa said the hand is too low. Elbow should be on the table.
Okay.
Robbie said armband is too high.
Sorry, the what is too high?
The armband.
The cuff?
Yeah.
Okay. I think you guys got it. So let's see. So we have, no one saw this. No backrest and no armrest. So your back and your arms should be supported. The cuff is not in line with the heart, right? So the cuff should be at the same level as your heart. Also, the cuff is over the sleeve, right? So you should have a bare arm and not over the sleeve or covering the sleeve. And he had just drank coffee. So again, that would also affect the reading. Okay, so I'm going to show you another photo, and you can tell me if there's anything wrong with this lady's technique.
She should not be crossing her legs. Her legs should be level on the floor.
Okay. Anything else?
Her left arm should be straight.
Her left arm should be straight.
Straight position.
You mean left as in her left, or us when we look at it, the left?
The one checking BP.
So it needs to be straight?
Yeah.
It depends. Is there anything else? How about her facial expression?
Well, she's very nervous, or she's upset.
Okay, is it a good idea to take your blood pressure when you're upset?
No, she should be in a, her mood should be, when she's calm.
Okay, so we got some of them.
Isabel also says she should not be leaning back.
Should not be leaning back. Okay, so let's see. So legs crossed, you guys got that. The patient needs to pee. It's hard to tell here because I don't have a full bladder here to show you, but should you take your blood pressure when you need to use the washroom?
No.
No, okay. Sleeve is too tight, so you can't really see it here, but when your sleeve is too tight, that's also going to affect your reading. So we do recommend that bare arm if possible. The patient is not relaxed. Okay, so those are just a few things that are an issue here with her technique. So here I kind of have a summary of some things that we mentioned that can affect your blood pressure reading. So if you look here towards the bottom, pain, if you're in pain, that would raise your blood pressure. Having a full bladder can also raise the blood pressure. If the cuff is over the clothing, so sometimes you think it's convenient, you don't want to take off that shirt, take off that sweater, but it can actually increase or decrease the reading, and so it's not going to be accurate. Okay, so these are just some of the things that can affect the reading. So now that we saw some photos on how not to take your blood pressure, now we're going to see how to take it, how to measure it properly. So here we have a gentleman. He's sitting and he has a backrest to support his back, and he his arm, that's the blood pressure is being taken, is supported. The cuff is level with his heart. His legs are not crossed. His feet are flat. He wasn't talking to anyone. So sometimes we do that, right? Like we're taking our blood pressure and then the doctor or someone asks us a question and then we start talking to them. So that's actually not the best way. He's also not watching the news. So it's not a good idea to be watching something that can cause an emotional reaction. So, so you can see here a summary of how to take your blood pressure correctly. Sometimes we also recommend that you discard the first reading, take a couple and take the average. And if, and usually I suggest that if you go to see the doctor, also bring a copy of your home readings. Because most of the time when we go to the doctor, we just got there, you know, it's almost like a light physical activity. You sit down, they take it, and you're a bit nervous. So it may be a bit higher in the office. So I always recommend that you take your blood pressure routinely at home and bring those readings to the doctor's office. And you can also bring your blood pressure monitor so that we can check it for accuracy. So you can use yours, use theirs, and see if there's a difference. Okay. So the sixth tip is to know your treatment goals. Now, what does that mean? So it means that you are the biggest advocate for you and your health. And if you are taking medications, it is important to know why you're taking these medications and what do we hope to kind of achieve with the medications, right? So for example, with pain, it may not be realistic to go from pain to no pain at all. Sometimes pain is very complex. So you may not get down to zero pain, but if you have no change in the pain or like minimal relief of the pain, then it may be a good idea to talk to the doctor, because that might mean that you need a higher dose or you might need a different type of medication. So it's the same thing with medications prescribed for depression, right? Because you should know when you can start seeing what you should expect and how long it will take. And so with respect to blood pressure goals, again, the goal is individualized, right? So less than 140/90 might be great for a 40-year-old middle-aged man, but that might not be a good goal for an old, frail man with a walker who's at high risk for falls, right? So goals should be individualized, and you should speak with your doctor about your treatment goals or targets when you're on medications. Now, it's the same thing with your blood sugar control, right? So how well or tightly you need to control it depends on your, may depend on your age, your other medical conditions, how long you've had the disease, you know, whether or not you are at risk for having low blood sugar. So these all kind of impact maybe what the goal the doctor wants for you. So for myself, you know, if I had diabetes, a goal, an A1C goal of less than 7 might be very appropriate. But if it was my 99-year-old grandmother in a nursing home, the A1C less than 7 would not be very appropriate. So again, you should speak with your doctor or pharmacist to discuss what the goals of therapy are when you are taking medications. My 7th tip is to dispose of your medications properly. Now, where should we, or where do we dispose of medications? So you can let me know through the mic, or you can type it in the chat. Where do medications go when we—
In a biohazard.
Sorry?
Yeah, in a biohazard box.
In a biohazard box? Where do people usually throw it?
You should bring it back to the pharmacy.
Yeah.
Yeah? Does that happen all the time, you think?
I think that's the most ideal way.
Okay, so bring it back to the pharmacy. So not in the toilet and not in the trash, right? because it ends up in our landfills and it might end up in our water. But I think a lot of times people are just, oh, I don't need it anymore, and then it's just convenient to throw it in the garbage. So yes, not a good idea. You should bring all discontinued and expired medication to the pharmacy. Okay, how about medications that you still need to take? Where should you store those medications?
In a cupboard that is nice and dry, away from the sun and out of reach of the children.
Okay, that is true. Anything else?
Never transfer, I don't know if that's considered storage. Never transfer your medication to anything that is not labeled or on any empty bottles, just for yourself.
Mm-hmm. But I think a lot of times we might do that because it's convenient, right? So sometimes I go see an older adult in their home and then I see a vial and there's like 10 different types of pills, and then they'll say, this is for my this and this is for my that, and I know what I'm taking. But for the healthcare practitioner who sees that, they might be concerned because they're worried you don't know what you're taking. So you're right, you should keep it in its appropriate container. And with medications that you're still using, you're right, we should be putting it in a place that is locked and stored in a safe place and kept away from babies, little children, and teenagers. Okay, because according to teenchallenge.ca, which is a website, the average age at which drug use begins is 15.7 years old, and 20.6% of teens reported using opioid pain relievers. So we need to keep these medications in a safe place. So sometimes I've heard of pharmacies not accepting medications that were not filled at their pharmacy. So if you want to know more about where to return unwanted medications and sharps, you can check out healthsteward.ca, enter in your postal code, and you can find the nearest pharmacy that kind of belongs to this Health Steward organization, and they will accept all the medications. The 8th tip I have for you is that it's never too late to quit smoking. So even when we smoke, after 20 minutes, our heart rate and blood pressure drop back to normal levels. By 12 hours, the level of carbon monoxide in the blood drops to normal. Within 2 weeks of quitting, circulation and lung function improves. Within 1 to 9 months of quitting, the constant cough, so the smoker's cough and shortness of breath, becomes less pronounced. By 1 year of quitting smoking, the risk of coronary heart disease is half as high as of a smoker's. And within 5 years, the risk of contracting certain cancers is half of what it is for a smoker. By 10 years of quitting, the risk of dying from lung cancer is half of that of a smoker's, and the risk of pancreatic and larynx cancer also decreases. And by 15 years of quitting, your risk of heart disease is equivalent to that of a non-smoker. But quitting smoking is very hard, and sometimes it may take several attempts. I've never really met one that was able to quit successfully on the first try. Sometimes it takes many, many tries and a good support system. So we do have some resources that through the Ontario government. So one is a smokers helpline. 2 is the Lung Association. And 3, there's a Help Them Quit website. So I just wanted to highlight with the smokers helpline, there's the number there. Service is available in English and French and in over 100 languages through an interpreter. And right now, I believe there's a free trial pack offer available on their website. So if you go to Smokers Helpline, you can kind of share that with someone who may be interested in quitting smoking. The 9th tip that I have for you is that more is not always better. So if you see here, I have a poster and it's a washing machine and all the bubbles are coming out. So more soap is not necessarily always better for washing your clothes. And the same is true for medical tests and treatment. And this poster was developed by Choosing Wisely Canada, which you may or may not have heard of. So Choosing Wisely Canada was developed by professional societies. So like the Geriatric Society, Pediatric Society, Oncology Society in Canada. And they came out with recommendations that identified tests and treatments that we commonly use in each specialty, but that wasn't really supported by evidence and that could expose patients to harm. So these recommendations were not intended to be used to establish payment and coverage decisions, but rather they were meant to spur a conversation about what is appropriate and necessary for each person, because everyone is unique. So you can go on Choosing Wisely Canada and peruse their materials to see what they have to say. So for example, I have here a handout, and this is from the Choosing Wisely Canada website, and it's about insomnia and anxiety in older people. Sleeping pills are usually not the solution. So it starts off by just giving a bit of statistics, how, you know, nearly one in 3 people, like older people in Canada, they take sleeping pills because, you know, they think that it's going to help them sleep a lot better. But they actually don't help that much. They show that maybe you sleep a little bit longer and better, but there's a lot of side effects that may be associated with sleeping pills. So it goes into non-drug treatment to consider as well. And they have a lot of these different pamphlets. So they have one about, vitamin D, when do I need to get an annual checkup? So just a lot of these pamphlets to better inform us so that when we go see the doctor, we can have that conversation. So in addition to those 5 questions that I talked about earlier in the presentation, that you should ask about your medication safety, you can also consider asking these 4 questions to your healthcare provider, such as your doctor or your specialist. So the first question is, do I really need this test, treatment, or procedure? Number 2, what are the downsides? Number 3 is, are there simpler, safer options? And 4, what happens if I do nothing? So for example, say you have kidney problems, you're seeing the nephrologist, then, the nephrologist may recommend dialysis. So then you can put it to this, like, do I really need dialysis? What are the downsides to dialysis? Are there safer, simpler options? Are there different types of dialysis? And what happens if I do nothing, right? Because although dialysis is life-saving and life-prolonging, there's also that quality of life aspect to consider, right? Depending on the age and the goals of that person. So this is just really to spur a conversation so that we can have more patient or, patient-centered care and a good quality of life. So again, you can check out Choosing Wisely Canada for more information. And the last tip that I have is that don't forget about food and lifestyle. So even though you may have to take a medication for a chronic condition, eating the right foods, having the right mindset, and incorporating movement may assist in disease or symptom management. So you may even be able to decrease your dose or even sometimes come off the dose of your medication just through food and lifestyle. So consider this. Medications never replace a healthy diet or lifestyle. So if you have diabetes, taking medications for your blood sugar does not mean that you can continue to eat, lots of processed foods high in carbohydrates. We should move every day, try to move every hour. And this may be difficult for people who have desk jobs, but try to set a timer so that you can still move around. Do different types of movement, such as resistance training and cardio, to build our body as well. Enjoy more home-cooked meals. Practice mindfulness and be more present. Try new activities, they may surprise you. And also to interact with others. And things to do less of is smoking, alcohol in excess, illicit drug use, sitting for long periods of time, and also worrying about things that are out of our control. So that is the end of my presentation. My contact information is there, and if you have any questions, you can certainly ask them now, or you can reach out to me via email.